I'll reveal the identity of this thyroid-sustaining mineral in just a moment, including how you can get your daily fix of the most effective form, regardless of what your diet looks like right now. But before we get into that, I want to shift gears for a minute and briefly cover 3 dangerous thyroid myths that could be keeping you trapped in a cycle of endless suffering. My goal is to help you break free from that cycle once and for all, and knowing these 3 thyroid myths is the first step. If I had $1 for every time I've heard this, look, if you've been dealing with thyroid issues for a while, chances are you're very familiar with TSH. TSH stands for Thyroid Stimulating Hormone. It's the main lab test clinicians use to identify if you have a thyroid condition, including underactive thyroid. But here's the thing. The TSH lab test alone can be terribly inaccurate. You can think of TSH as a thermostat. It detects when your thyroid hormones are too low. Then it tells your thyroid to produce more T4. Once your T4 levels rise, your brain stops releasing TSH. This can often lead to situations where people will then have normal TSH and T4 levels, but their T3 levels are still low because they're poor converters, just like what we talked about. Yet many doctors seem unwilling to look beyond basic TSH and T4 labs. So if you've ever had a doctor tell you your thyroid is fine because your TSH was normal, even though you were experiencing symptoms, there's a good chance this is why. And as I said before, you're not crazy. Mainstream medicine has simply failed you in this case. This TSH inaccuracy isn't just my opinion either. According to naturopathic physician Dr. Mary James, the standard TSH range could be missing as many as 75% of people with low thyroid. Plenty of studies confirm the inaccuracy of thyroid lab tests as well. Researchers from Georgetown University published a study in the Annals of Thyroid Research, and after studying 21 patients with symptoms of low thyroid function, the researchers discovered the usual lab tests prevented correct diagnosis in almost 50% of patients. One of these cases was a 76-year-old man experiencing early afternoon fatigue, hair loss, dry skin, and constipation. All of his standard thyroid lab tests came back normal, but when they confirmed his levels with liquid chromatography mass spectrometry, which is more sensitive than regular blood tests, they discovered his free T4 and T3 levels were both low. Sadly, this type of misdiagnosis happens all the time. Fortunately, since this gentleman was included in the study, he received the treatment he needed, and just 2 months later, he felt like a new man. His energy and cognitive function improved, and he no longer suffered from dry skin or constipation. Another study published in Clinical Biochemistry confirmed this gross inaccuracy with thyroid labs. In particular, this study found that initial T3 lab tests were inaccurate 45% of the time, meaning those 45% of the people studied who initially had normal T3 labs actually had low T3 levels when checked by mass spectrometry. One case report in this bunch really stuck out. A 56-year-old woman had been diagnosed with an underactive thyroid 3 years prior. She had been taking T4 medication for a full year with no improvement. She struggled with losing weight, low energy, muscle weakness, constipation, and dry skin. Initially, her T3 labs showed up normal. Yet, when they were rechecked using mass spectrometry, they found her T3 levels were in fact low, which explained her continued symptoms despite taking T4 medication. In other words, she was likely another poor converter. Well, after receiving T3 replacement for just 10 days, all of her previous symptoms improved. How remarkable is that? Here's your main takeaway from this. Don't let normal labs, especially normal TSH labs, stop you from getting the relief you deserve. And when you're getting thyroid labs done, make sure your physician orders a free T3 level too. But remember, a number on the screen only tells part of the story. Any healthcare provider worth their weight in salt should also consider symptoms. If you find your provider is quick to dismiss your struggles because of normal labs, which often aren't accurate, then maybe it's time to look for someone else who will actually listen.